No matter how conscientious a doctor is, bad things can happen to their patients. And I believe that the true measure of a doctor is how that doctor reacts when the proverbial you-know-what hits the fan. Here are two cases where it hit the fan for me. Several years ago, I had a 20-something, very attractive young woman come to see me for injectable filler. She was hoping that I could inject some filler into her nasolabial folds to fill them in. So I took a hyaluronic acid filler, attached it to a needle, and was about to inject it into her creases when the lights went out. It was pitch black. We lost power to the entire 24-story high-rise building that my office is in. So I flipped on the light on my iPhone and I told her, Jean, not her real name, I think we're gonna have to cancel your procedure. Obviously we lost power. I don't know when it's gonna come back on. Let's have you come back in a week or two and we'll get you taken care of. We do have a procedure room that has windows that basically go from floor to ceiling. So as she walked by, she looked in, saw that there was this room that was available, and even though it was a cloudy day, the room was pretty well lit. So she said, hey Dr. Youn, I drove about 2 hours to get here. It's gonna be such a pain for me to have to drive all the way home and then come back in a few days or a week. Can't we just do the treatment in that room with the windows? I felt bad. I didn't want her to go home feeling like she didn't get what she wanted. So I took a chair, I pushed it by the window, and I went ahead and injected her nasolabial folds with filler. It literally took about 10 or 15 minutes. It was super smooth. She did great, and she ended up going home feeling very, very happy with the result. I didn't think anything of it until the next day I was about to scrub in to a big operation. I had a 6-hour facial surgery, facelift, upper and lower eyelid surgeries. And right as I was about to go into the operating room, I got a call from my office. My physician assistant sounded very concerned. She said, Dr. Youn, I just got a call from Jean from yesterday, and she is really concerned. She said that she's got terrible pain in her nose, in her upper lip, and her face looks all discolored. What should I do? So I told my PA, get her on the phone right now and have her come to the office immediately. And my concern is that the most feared complication of injectable filler is an intravascular injection, where you accidentally inject the filler into a blood vessel, that blood vessel gets clogged, and any body part supplied blood by that blood vessel can turn black, it can necrose, and it can die. So I ran into the operating room to stop the surgery just as they were intubating my patient. It was too late. So I thought to myself, oh my gosh, I've got this patient who's coming in, hopefully she's fine, but because my patient is already on the ventilator and is prepped and ready for surgery, I've got to continue with this 6-hour surgery. So I start the facelift and everything is going smoothly, and about a half hour into the facelift, I get a call from Devin, my PA. She tells me, Dr. Youn, this is really, really bad. Her entire face is modeled all the way from her upper lip all the way up to her forehead. And there are parts of her nose and her nostril that are completely pale white. They don't look like they have any blood supply. And on top of that, she is in terrible, terrible pain. I feel a flush go through my body and my stomach sinks. I feel like I'm gonna throw up. I felt so terrible. So I tell Devin, I say, take all of the hyaluronidase and inject it all through her nose and by her nasolabial fold where I had injected her the day before. We had several hundred units in the office and I told her, just inject all of it into those areas and then give me a call back. And about 20 minutes later, she calls me back, slightly relieved. And she said, Dr. Youn, it does look a little bit better. I've got some pink in her nose now, but she's still in terrible pain. I think I need to send her to the hospital. And I said, you definitely need to send her to the hospital. Send her to the hospital that I'm working at right now. Have her go to the emergency room and I will meet her there as soon as I can. I get off the phone with her and I continue on with this 6-hour operation. About 45 minutes later, I get a call from the ER and they tell me that the patient has arrived. Luckily, the hospital has a large supply of hyaluronidase. Hyaluronidase is basically an antidote to injectable filler. The injectable fillers that I use in my office are all made of hyaluronic acid. And hyaluronidase basically dissolves it away, some of it instantly. So when she arrived to the ER, I scrubbed out of the operation, I sprinted into the emergency room, I drew up a bunch of that hyaluronidase and started injecting it all through that side of her face. And everywhere I'm injecting it, her face is starting to pink up and the blood supply is starting to return. My initial concern that she could lose a huge chunk out of her nose and out of her upper lip or even go blind was relieved. She told me that her pain was getting better, she was looking better, and so I said, look, let's admit her to the hospital, and then I ran back to the operating room and I finished those operations. Well, luckily, those surgeries went very, very smoothly, and the patient did really well. Right after the surgeries were completed, I ran back to see my patient in her now hospital room to check and see how she was doing. And for the next 24 hours, every 3 hours, I would go to the hospital and inject more hyaluronidase into her face. And every time I would inject it, her pain would get a little bit better, and the mottled, uneven colors of her face, signifying poor blood supply, gradually receded and turned pink. I literally think I slept maybe 2 hours that night. I was so worried about her. Well, about 36 hours after she initially presented to the hospital, we discharged her from the hospital and we started hyperbaric oxygen therapy. I wanted to pull out all the stops to treat this patient. So I did every single medical intervention that I could think of to try to save, especially her nose. Well, luckily in the end, because of my quick interventions, she ended up doing great. She ended up with just a tiny little scar on her nostril that is easily covered up by makeup. So some of the things that have changed since this happened to my patient is that we're now using cannulas, which are a safer way to inject filler. And no matter what, I never inject patients by the light of a window, even if it's a sunny day. So that was something bad that can happen if you undergo filler injections. But what about if you undergo something much more invasive, like a facelift? This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video. Several years ago, I performed a facelift on a woman in her early 60s, and the surgery itself went super smoothly. Basically, I make incisions around the ears, I lift the skin and the muscle up and remove any unwanted fat pockets. Surgery took about 4 hours. It went very smoothly without a hitch. Now, I do all my facelift surgeries in the outpatient surgery centers of a hospital, and I keep those patients overnight just in case they have a bleeding complication. The highest risk of bleeding is the first night after surgery. Well, this patient went to her room in the hospital, and I started driving back to my office a few hours later because I had a surgery after hers that I did as well. My office is about 20 minutes from the hospital, and as I was just about at my office, I got a page from the nurse taking care of my patient. She said, "Dr. Youn, I'm seeing your patient Sandy who had a facelift, and I think she's bleeding." So when I have patients who have bleeding after facelifts, I know that it can literally go from 0 to 100 in mere minutes. If you have bleeding underneath the skin of a facelift, just a small amount of blood can be a major problem. And the thing that we worry about is if that bleeding is uncontrolled and it fills up the patient's neck, they can literally suffocate and die. I abruptly turned my car around and I started driving back to the hospital. 5 minutes after her first call to me, I got another page, and this time it said those 3 letters that we never want to see as a doctor, 911. When nurses page you 911, that means things are really bad. So I call her on my Bluetooth as I'm driving back to the hospital, swerving through traffic. She said, "Dr. Youn, I'm really concerned. I think her neck is filling up with blood and I don't know what to do." Well, of course, this is rush hour, and here I am slamming my foot onto the accelerator, hitting the brake, trying to swerve around, not caring about my own safety because I knew that my patient needed me right now. Finally, swerve my car into the hospital right at the front door. I park it where I'm not supposed to, and I sprint out of my car, run into the hospital. I bound up the stairs to the second floor where her room is, and I run into her room. And the sight that I see is from a Star Wars movie. She looked like Jabba the Hutt. Her neck was so filled up with blood that you couldn't make her jawline out at all. Standing next to her was her nurse with a pair of scissors, shaking. And her husband was standing next to her with his eyes as big as saucers. The nurse tells me, "Dr. Youn, I tried to take some sutures out, and I tell her, don't worry about it. I grab some gloves off of the wall, not even sterile. I take those scissors and I proceed to cut all of my stitches out." Well, that didn't do it. I actually had to take my hand, go into her neck, and I pulled clumps and handfuls of blood out. I plopped the blood onto what looks like a pee pad on her bed, just handful by handful, and slowly her neck begins to deflate. I tell the nurse, "Please call the OR and tell them that I need to bring her into the OR right now, stat." As I pull the last clump of blood out of her neck, I look down and see this little blood vessel squirting blood at me. I put my finger over that artery and I tell them, "We gotta go to the OR now." An entire crew, within about 3 minutes, is then off to the OR. We get to the operating room, I cauterize that blood vessel a few times, and I put a stitch around it just for good measure, and I basically relift and reclose and re-sterilize everything. After the surgery was over, I go back to the floor to go talk to the nurse who had so bravely tried to remove my sutures. And I said, "Look, you did a great job. Next time, if you ever see this happen again, just take as many sutures out as you can." And she replied to me, "Dr. Youn, I could never do that with your patients." And I replied to her, "I have complete faith that you always will do the right thing." So what ended up happening to her after all of this? Well, she healed perfectly, believe it or not. You couldn't even tell that she had to have this surgery done basically twice. Whenever you operate on somebody, bleeding is a complication that can happen to anybody. And in certain cases, that bleeding can be very, very scary. But the key to treatment is to act quickly and decisively. Well, this story, along with many others, was in my recent book, Playing God. So if you want to read stories like this, check out my book. I also told a few other crazy stories of some of my worst potential complications in this video right up here. Take a peek at it. If you like this video, I think you'll love that one as well. And if you've been enjoying these videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.